in this particular case, did I ask you to tell us what was the actual cause of death?
The cause of death is shock secondary to death of multiple bowel segments.
And death of multiple bowel segments, is that known as bowel ischemia?
No, that's called bowel infarction.
Okay.
Which is due to bowel ischemia.
I jumped.
Which is
Jump
due
step.
to clotting, to thrombosis. So this is what's happening here. Okay. First there's a clot. The clot cuts off the circulation. When you cut off the circulation, then you cut off the oxygen supply. We all need oxygen to survive. Cells need oxygen. Once you cut off the oxygen supply, you're going to cause death. We call that necrosis. Once you cause necrosis, sooner or later, depending on the amount of necrosis, you're going to cause shock. Okay. Think of a heart attack. Okay. A heart attack is the arteries in your heart get clogged. There's a clot. And you're going to cut off the supply of blood to a portion of your heart. That portion will die. That's a heart attack. In medical terms, it's called a myocardial infarction because it is an infarct. A piece of your heart will die. If it is big enough, the person will die. If it isn't big enough, you'll survive a heart attack. Okay. There's nothing different than a heart attack than this. This is a heart attack, but it's in the bowel, and it is not caused by arterial problems. It's caused by venous problems.
Can I ask you
That's
about
the big
that?
difference. Yes.
So the blue that we're looking at on this display, that's the venous system. Not the entire venous system, but the venous system for this area.
Those are veins, and the artist, always color blue because it doesn't have as much oxygen. When it's oxygenated, which is in the arterial side, is red. The fact is none of us have blue blood. It's just darker. So when it's oxygenated, it's bright red. When it is not oxygenated, it's sort of dark blue, red. So that's why all the artists make a blue. Those are veins.
Okay. Well, is the fact that the disease process in Miss Chapman occurred in the veins as opposed to the arteries important?
Very important. It changes completely the progression and the symptoms. It does not change the end result.
Okay, the end result being?
The end result being necrosis, death of tissue, shock.
But how does it change, explain to the members of the jury, how does it change the symptoms? If this was arterial, what would you expect?
Well, let's go back to what I said about a heart attack. Okay, a heart attack is you cut off the arterial circulation to a portion of muscle. When that happens, that takes a minute. And when that happens, you get a lot of pain because the muscle has nerve endings that tell the brain, hey, something is wrong. I get no oxygen. Sends a message in the form of pain. Okay. And the reason that happens like that is because you're cutting off the oxygen in a matter of seconds or a minute. When it is the venous circulation, is a different story. The venous circulation is a lot less pressure. The venous circulation, when there is a clot in the venous circulation, it takes time to develop. The venous circulation has a lot of these little veins in here that still supply a way for the blood to get out of that area. So it takes time for necrosis, for death of tissue to take place. And the tissues accommodate, particularly in younger patients, they accommodate. So it is unlikely that you're going to have a sudden onset of severe pain. It is a matter of days before you actually get symptoms, and the symptoms develop very slowly and progress over time. In fact, the symptoms, not unusually, are intermittent. And the reason they're intermittent is because some of these clots are forming and disappearing, forming and disappearing. And some of these little blood vessels are opening and closing. So it's a totally different presentation. The end result is the same.
So with a venous thrombosis, are there signs and symptoms that you can pick up clinically?
Sure, there are signs and symptoms, but they're usually not as sharp, well-defined, sudden as they are with the arterial side. And like I said, they come and they go, they can change, they're non-specific. I mean, when you have a heart attack, you got chest pain, the pain goes to your neck, it can go to your left side, classical signs and symptoms. When you have this type of problem, you can have a little abdominal distension, you can have a little pain. The pain is not necessarily in one particular place, it can be anywhere in the bowel, it can come and it goes. It's nothing classical. There is not a classical syndrome. In medicine, we function with syndromes. That means that there is a classical history, there is a classical physical examination, and in the brain of the physician, you've got a diagnosis.